Okay.
Namaste. We welcome you for Tathaastu Series. Actually, this is the first episode. The first one was actually an introduction. We are having two experts, respected Dr. Devang Kanuga sir and Dr. Bhavit sir. Both of them are very well-known names in endoscopy all over the country. People actually come to their centers to get trained. They are excellent human beings as well. We have chosen this particular topic. We call it as non-endoscopic passions of an endoscopic surgeon, and how these passions are useful or how they contribute towards their day-to-day life and their routine medical practice. So we welcome you both, Dr. Devang sir and Dr. Bhavit sir, and thank you so much, Ashish and Kirtan. So we can start the session, and we are very much eager to know the life experiences that you have throughout this passions, or why did you cultivate this particular passions, and what are your thought process when you begin it, and how you are taking up as nourishment for the rest of the journey that life is. So thank you. We welcome you, sir.
Thank you so much, Munjal, for inviting us. It should be a great experience for us also.
Thank you, sir.
So, good evening, sir. What are your non-endoscopic passions? We are eager to ask that you and Bhavit sir are here at a huge platform. You are doing so much high-end surgeries. So we are eager that what will be you doing other than that, and what other things surgeon can do, and they like. It's not like always you are into surgery. Sir, for you, sir, what are your endoscopic passions?
See, my greatest passion is singing, apart from endoscopy, I would say. But apart from singing, of course, I love listening to music. I love photography and traveling also. But yeah, I would say singing is the main passion for me.
Yeah.
Okay, and sir, Bhavit sir.
Yeah. Good evening, Munjal. Good evening, Kirtan. Good evening, Ashish.
Good evening.
Yes, sir.
And my mentor, good evening, Dr. Devang Kanuga, sir. Passion about I am in, apart from my endoscopy, which is my prioritization passion. And apart from that, I learned to learn everything in my life. Like basically, I am more towards my financial passion, photography, and graphic designing courses. And above all, I love sports because I am previously a table tennis player. So
Good, sir.
I always love to play sports in my life after the completion of my professional work hours. So that is my passion.
Very nice, sir. Very nice. So, being an endoscopic surgeon, of course, that endoscopy remains the primary passion, as you rightly said. But yes, sir, as Devang sir said, singing, and for you, photography, the financial planning, graphic designing, and what not, what other sports like everything. So, this is so good to know. And so, may I ask both of you, sir, that what made you drive towards these passions? It's like you're doing endoscopy, you are full busy professionally from morning to evening. That what is that single factor? What made you drive towards these passions?
See, music basically is with me since my childhood. Even my father used to sing, and he loved to listen to the music. So from the beginning of my childhood, there was some musical atmosphere at my
Wow,
home.
wow. So that music
And
runs in your genes, in your family.
yes, and that is why I started, listening to music, and then started to learn music. Because when you do something with passion, with the thing which you love, then you dive deep into that, and then you start learning it. So then I started learning singing. I have a teacher coming at my place every Sunday, and he teaches me
Okay.
singing, and I genuinely love it. See, I am not doing singing to expect some external rewards or some good words from other people, because singing keeps me relaxed in my daily routine, and it gives me a lot of mental pleasure, and that is why it is driving me towards singing.
Correct. So as they rightly say that when you love it, you do it. So yes, for singing, you actually love singing, you love music, so you do it. Good, sir. Bhavit, sir.
Yes, Kirtan. See, I divide this professional drive and non-professional drive. See, professional drive, I will narrate all this thing in small incidents. See, when I joined KSSL Medical College, my mentor, Dr. Devang sir, He's also doing mobile surgery. So I developed my drive and passion towards that. So that is my professional passion. And non-professional passion I developed because every time some incidents happens to me, I narrate in a very small time that my father buys some life insurance policy, and apart from that, it is a basically a very pathetic policy. And so I understand that the financial knowledge should always be there amongst us and should require, because we doctors are very poor in finance.
Right.
So I started learning CFP, that is called Certified Financial Planner, and
Oh,
I
good.
did a 2-year course and got a degree. After immediately
Very
that,
nice.
I hired a person for my marketing of hospital and my endoscopic work, and he is not doing properly, not giving proper time. Pathetic work is there. So that instant drive me to learn graphic designing. So I
Oh,
started
Necessity.
my
oh,
graphic designing course.
Necessity is the mother of invention, kind of thing,
mother
right?
of invention. Correct, correct.
So that's why I am learning one by one skill because of some incident that happened to me in my life.
Brilliant.
So that's why in this way I am doing non-professional these things.
Correct,
But sir,
correct. So,
what you love, that actually we are asking. What you love, you like
See,
most?
my nature is that whatever I started, I always loved my work. And Kanuga sir rightly said that everything requires a deep knowledge. So once I decided that I have to do this work, then I started to searching about that, and I go very very deep to that uh, ocean so that I can learn from bottom, and I will always be a student in each and every field, so that you can become a teacher in the future.
So basically,
correct, correct.
you
So they
give
rightly
100.
say that
Yeah.
yes, yes, there are only two kind of people, either learners or non-learners. So even at this stage, you keep learning, whether for the Devang sir, whether you keep learning your singing, your music, and whatnot. And for you, it may be that graphic designing, your financial planning, and the photography and whatnot. Very nice, sir. Very nice. So, sir, please tell us that how do these non-endoscopic patients impact your daily life? What is their impact, sir?
See,
So whether it is for you only, whether it is for your family only, what is your impact on your overall life, sir?
no, it will impact the overall life. What I will start with this sentence that without music and singing, the life would be very monotonous for me. You know, with music and with singing, I can express few things which I cannot express in my words. Singing improves my mood. It is basically a mood elevator. You know, it also decreases a lot of anxiety in you. It improves your blood pressure. It decreases the blood pressure. There are scientific studies. It improves your sleep pattern, sleep quality. It elevates your mood. It will increase your mental alertness. You know, it will improve your memory also, because you need to remember the lyrics and all when you sing. So that is how it will help. It will improve your lung capacity. See, when you sing for a longer period, you need to take deep breaths and all. So it will improve your lung capacity also. So these are all important things which are, connected in daily life. So it reduces stress. And for doctor, you all must be knowing, stress is a very subtle part of your life, but it is very important part of life. And for me, like singing and music decreases that stress, and that is how it helps me in my daily life.
Wow, so good to know this, sir. Bhavit,
In
sir.
Yes, Ketan. In a nutshell, I tell that stress relieving is the one of the major factor. But apart
Fine.
from that, you got a very good connectivity to the people. That is a major factor, that you meet the people, different people, apart from your non-professional uh, men
Yeah.
or women like that people, and you got a very good social connectivity. So you can
Good.
know that what is going in the market, what is going outside your field. So that will give you a boost up in your routine life. So in end of conclusion, I say I feel a sense of accomplishment when we
Oh,
doing professional
good.
work with non-professional hobbies like this. So at the end of the day or the night, you feel that yes, I have done something apart from my routine work. So that
Correct.
gives again a good drive for tomorrow to work hard so I can do more than 5 surgeries. That
Wow.
gives me a good confidence that after 4 o'clock I have to rush to my non-professional hobbies career. So that
Wow.
gives a good work satisfaction.
Very nice, sir. So that this non-endoscopic patients even keep you running, probably,
Yes.
right?
Fuel,
It's
I
like
think.
it's
For
like
betterment
sir,
of life in
uh,
general.
getting away from a monotonous thing. It's like
I think
Yes.
there are
you are
three
telling.
things. There are 3 points I find in common up to this particular conversation. One is you both are excellent in giving 100% in whatever you do. Now that's a brilliant quality, because at times what happens is when you try to learn something, you actually give up on some of the efforts. But you both of you have this particular quality in common, that you get into the depth of something that you learn. One thing. Second thing, as Kanuga sir said, I mean, a little bit of stress is actually something which gives you the window of growth. If it is not that, we are going to stay like where we are or where we have been, and we are not destined to be here, actually, I think. So taking that little bit of stress, and then, as both of you say, that adding up some passion will be a great mixture for the future growth and upgradation of yourself, I think. And third thing, as Bhavit sir said, it broadens your horizon. You meet new people, and then I think it's all about thinking that, okay, now this is something, a different way to look at the things, and that's actually increases the respect for others. So thank you so much for that. Yeah, Ashish.
So many times it is seen that, sir, we doctors like keep living in our self-made prisons. We don't see anything beyond our medical profession, and
We
with this non-professional commitments or non-professional passions, they actually keep us moving. Very nice, sir. Thank you for
yes
your
yes
input,
yes
sir.
We
yes
were
sir.
brought
So
up like
again I like
that.
to ask that these things impact on your surgery, Devang sir.
Yes, definitely, I would say. See, singing and music has a remarkable capacity to induce transformational changes in the brain. It improves your concentration, it improves your memory. As I said, it makes your reflex very powerful, so that you can tackle unexpected complications very calmly when you are operating upon that. Listening to music, singing, and everything, it will releases. It has a scientific base also. It will help in releasing three powerful hormones in the body, like dopamine, serotonin, and oxytocin. These hormones, they will give us a rush of pleasure, rush of support, reward, motivation, all those things. It will elevate your mood. It will, improve your mental alertness. It will improve your concentration. And once you are relaxed, a relaxed person always performs a better surgery. Like everybody would agree to that.
Always
So
always.
Absolutely,
it will help.
absolutely.
It does help.
Sir,
Yes.
so do you play music in your OT?
No, not routinely. No, I don't have that
Exactly.
habit.
So when you are
And sir
happy, when
again,
you are happy
Sometimes
performing,
one distracts.
so when you are happy performing surgery, when you are, I mean, you are, for example, performing 1001st surgery, TLH, which is very routine and at spinal level for you. Do you feel like singing while you're or humming some favorite tune?
Absolutely, I do sometimes. My staff and my OT staff and everybody
humming,
knows that Sam
humming,
Macha
humming.
is sing.
And we have one
Like
great fellow. We have one great fellow with us called Dr. Kirtan Vyas. He has the central music system in his hospital. So whenever
Yes,
he is operating, or
yes,
and the sounds, I mean, soft soothing music is always going on in the OT
Softly.
and rest of the hospital. Yeah.
yes, yes. So even my staff knows by now that when the music is not switched on, then I'll not perform any surgery even. To that extent, I would say. That
Yeah.
soft instrumental music literally keep us calming while
Yes.
performing the surgery.
Yeah.
So that is very nice, sir.
Yes. And
Well said.
Devang sir, again, how many hours one should? Is there any time limit, or there should be a time to work in duration in a day? Like
For what? For your
for
patients?
no sir, for our working, we should
No, no.
8 hours, 6 hours.
I think you don't have to be driven by an hour. How many hours you can spare for work, or how many hours you can spare for your passion and all. See, basically the beauty of passion, which is not primary work, which is not your primary work, is that whenever and whatever time you can spare for it is enough for that. right? There is no compulsion, and that is the beauty of your passion. There is no compulsion to perform it, right? Like, maybe atlo time, I mean, we need this much of time, this much of time. It is not like that. So whatever time you can spare, it is fine. Work, of course, everybody will have to do an adequate work to survive.
Yes, Ashish, sir rightly said that work we have to do and we have to
Yeah.
complete it. For the
Yeah,
life
that is
going on, we have to do a professional work. But where you find the time or you can balance your professional work with your hobbies, that will be the great skill you have to develop. And my sir, Mukul sir, always told where to stop. It should always be in your hand,
yeah,
right?
that is
Like sir can do 10 surgeries per day or 12 surgeries per day, but that is not the scenario should be continue all the time. Otherwise, we will drain out and we will keep our life will be very much boring. So always you should have to draw some fine line or something certain lines in your life that this much hours I will work, this much hours I will give to my non-professional hobbies. Not you should be bounded in all situations. That should be always be a flexible, but you
Absolutely.
should have to keep and always the non-professional work gives always anytime you can you will be what you can told that you are happy to do that work even though you are so much tired of your professional work, right?
Correct,
So
sir.
I
So
think
where to
in
stop and when to stop is probably we all need to learn as
yes,
doctors.
definitely.
Yes.
I think they say that we take 3 years to learn to speak, and we take rest of our lives what not to be spoken. I think so. That goes with
no,
everything.
we are shy people, we are introvert people, we are limited to our work, we are not that much socialized that
I think
all these thing has to be there. So we will we get at least we will go out and it is we talk and we will involve. We are very much involved in our work nowadays actually.
Yeah.
See,
So
it will open up your outlook.
rightly said that
Overall outlook is open.
absolutely. So, Bhavit sir and Devang sir, to both of you. I mean, we all know. I mean, everybody knows you, like as a famous endoscopic surgeons because you have earned that particular tag. And I know that tag doesn't mean much to both of you, but that's the label that you are now given in the medical fraternity. How do you like to be known as an endoscopic surgeon for the rest of the life, or as somebody having those passions like you are singer, the singer, or the photographer, or somebody who plays tennis so well? Bhavit sir plays tennis amazingly. We still have to play a match, but yeah. So how do you want to get known as some tag label, or just a normal human being? Yes.
No, sorry. Of course, as an endoscopic surgeon, I would like to be known as an endoscopic surgeon, but I would like to add a tag that an endoscopic surgeon who sings well.
Brilliant.
Wow.
perf- perfectly put.
So best
Fellowship
of both the
fellowship.
worlds. Best of both the worlds.
Yes.
Yeah,
See,
Bhavit sir.
endoscopic surgeon tag must for your life. See, and your hobbies gives a slight edge to that sword. See, I will say a cherry on
Perfect.
cake. Everybody knows sir as an endoscopic surgeon or me as an endoscopic surgeon. But whenever I go to another place or some doctor's place and he praise me with my photography or my other works or financial tips he wants, so that gives an immense pleasure in my heart that I have achieved something apart from my endoscopic passion.
Wow.
So I think both should be balanced or not should be balanced, but you should do it as a your heart says. Whatever you want to do, you can do, and that will give a very good recognition in very in good societies also. Sir, sir is singing so nicely, so everybody says, "Sir, આજે કયું song ગાયું નવું?" So that gives a immense pleasure to sir also.
Yeah.
Yes.
Okay, I am recognized with singing also.
So,
Absolutely.
both of you have traveled, this many years on this earth, like accumulating a lot of experiences, life experiences, as well as the professional, personal, social fronts. I'm not using the word struggles or challenges because everybody faces that, but you people have, you know, earned through all of those phases of life. So, how do you see life as a whole? What is life to you both?
Very difficult question, very philosophical question, I would say. But before answering this, I would like to sing two lines about life, if you allow me.
Yes, sir. Yes.
All-
Of course, sir.
जिंदगी का सफर है ये कैसा सफर कोई समझा नहीं कोई जाना नहीं. See, life is like that. But
Mystery.
I would say is that you should have a purpose of life. Like, the purpose should be to bring out your own abilities out. For me, life is a journey of self discovery and personal growth. See, life always teaches you lessons every time, every year. I mean, every time, some incidents happen, it teaches you lesson. So you have to learn from that lesson, and you have to, bring out your true potential out. It may be your surgical skill, it may be like singing, and with those potentials or with those skills you can help, like with surgical skills you can help your patient. With singing you can please other people. You can have an ability to help someone, so you can help your friends. So all these things is about life. So I believe that every experience which life gives, whether joyful or challenging, it brings valuable lessons and opportunities for growth. So you have to keep growing. That's all.
Brilliant.
That's life. It is not that the daily routine, the daily routine moments and daily routine things, that is life. It is not life.
Brilliant. Yes, sir.
See, Munjal, I read one book before 1 month about life balance, and certain topics are on doctor's life. So in that I read some sentences like that it's a biological process. It's a complex interplay between your biological process and human experiences. So one doctor written that it's not just a merely absence of the disease. How you feel from inside of well-being, that is most important. So in life, sir rightly said the growth is required, but as patient requires psychological emotional support, we also require a psychological emotional supports. So that's why we should have to see our life apart from professional work also, and we should live the fullest extent what we can do it.
Brilliant.
Right?
True.
Passion makes you feel like meditation. If we can talk about meditation, that you both said that it relaxes you, it helps you in everything. So is it can be comparable to meditation?
Of course, yes. See, singing for and music is like meditation, right? As I said, you get absorbed mentally. Like time seems to fly when you sing and when you listen to music. It improves your concentration. You concentrate on certain thing. It reduces your stress. Then it's a state of mind like meditation only. So of course, while I sing, I feel like that I'm meditating.
So that is meditation.
Yes,
Yeah.
absolutely, absolutely.
So you are actually in your trance whenever you are singing, probably sort of.
Yes, yes.
Different zone of
Bhavit sir.
life.
Yes.
So when we are in a non-professional work, we are a different zone of life. So at that moment, we doesn't think about what happened to that patient, what doctor said, what next we are going to do. But 2 hours are for us, and we feel very proud for that also. And apart from that, I always feel for healthy life, you require certain kind of your hobbies, so that you inner peace, mind become your more concentrated in a other day. You will dopamine release will be there, so your strength will be much more improved for next working days also. So for that I feel life should be balanced, and you should drive your passion also.
Correct. So certainly, sir, like life beyond profession or life beyond endoscopy for you too. So that is literally there with us. We must believe that. And so, sir, what do you believe as a work-life balance? As Bhavit sir, you rightly mentioned, what do you actually consider as the work-life balance
See,
after all these things?
all the things, commitment towards the professional work is always there, but time management is required for your balanced life. Okay, so that gives a good recharge for your professional life. So what I do, that I will always settle my list also. Okay, be like I will work from 8 to 4 like that, and then after give some time to this. Apart from that, I have to also balance my family life also. your children, your wife also. So everything that gives a good balancing life. So that gives me a what you call as a creativity, management power also. That
Good.
also helps me in my work also. That how to manage these situations. Like sir lightly said that even some complications happen, then our mind will be very calm. Otherwise, we are so much annoyed, anxiety on our staffs also there happens. So that will be a way of when you doing your passion or giving some time to non-professional life. So I think that we can balance by these situations.
See,
And always balance of life is ongoing process. So you can't do in one day. So that requires certain time, certain years that it should be balanced. And we always person like a doctor are always workaholic. So we get a knowledge after certain years. So I strongly suggest that the young person or young doctor should always started from early years so that can give that they have a good benefit of what can a healthy life
Correct. So sooner is better always.
always.
see, work life, I would define like this, that work is work. Like say everybody will have to work for, I mean, professionally to survive in this world, like right? And life is your passion. Whatever you do for your enjoyment is your passion, and that is what is the actual life. So the amount of time you spend doing your job or your work versus the amount of time you spend doing what is important to you outside your work, that is work-life balance, right? So you work, you dedicate certain time for your work, for your job, for your surgeries, and then in rest of the time, you need proper time for your family, for your friends, proper sleep you need, eating time, and after that, you need some time for your passion. So you have to have that harmony in your life between work and your passion. And I would say if you are very happy in the morning when you go out of for work, and if you come home very happily, that means your work-life balance is to the point.
Wow,
Yes.
wonderful, wonderful.
Yes.
Can I say that? Can I frame it in that way that you have mastered your professional side so well that you can actually focus on something which is non-professional or your passion or your hobby, and that's why I think again the key lies in mastering whatever is whatever profession you are into, and then you'll be able to be in present that in that particular non-professional hobby. Can I frame that?
Yes, yes, absolutely.
Yeah.
If I'm struggling with my profession, if I'm struggling with my knowledge or skills in whatever I am into, I won't be able to do anything beyond it, I think. So maybe God's blessings plus your own efforts have done this for you, that you have mastered your profession so that you can actually, when you are out of that profession, you can focus on something else as well, I think. So
Correct.
So
Yes.
that it's the mindset I always say to my fellow students that you should have to change from early. See, Munjal, always we are working so hard that you want to become master or you become a number one in your career. So at that given point of time, we always misses all the our hobbies is and all these things. So I just narrate that we get a knowledge after certain years.
yeah.
So you rightly said that after becoming master, we get some chance or some time to develop our hobbies. But I retrospectively thought that we should have to start it earlier so that we can work uh,
More
very
efficient.
far. You know, so
More efficient. Yeah.
sometime I drained after 50 years or 55. So we if you want to work for 60 years, so that's required your extra time, hobbies, and all these things.
Brilliant, brilliant.
I
But
feel very late for my hobbies to develop.
yeah, but again, they are not the need or necessity. They are out of the desire that you have to learn newer things and to broaden your horizon. At the same time, not to challenge your intellectual capacity, but maybe
Yeah.
allowing an opportunity for your brain cells to keep functioning, avoiding it to get decayed with whatever is known. Because we have a zone where we know something, it's in subconscious mind. But then we have a zone which is not used, and then we keep on exploring it and using it, and that's how for brain as well, you call it as use it or lose it. So I think, yeah. So
Okay.
yeah.
Yeah. One point is always there in all our doctors' mind. I personally believe that the finance. See, initial time we are struggling with works and all these things. We doesn't have enough finance to fulfill our hobbies also,
Yeah.
right? You that you are doing photography, so you require 4 lakh of cameras. Initial phase, it's not possible to buy that. So we develop our hobbies in later life when we have enough finance to balance our life, right?
Yeah.
Yeah, I would say doctors are the worst financial planners. Worst.
Definitely.
I don't know, some of the doctors would not like this, but I have seen
Yes.
a lot
The
of
Bhavit
they,
sir
they
probably
all
understood this
I'm
very
not saying
fact
that they are not
earlier.
ugly, they don't like anything, but they don't plan their finances, and that is why they suffer sometimes later in their life.
So we are always what happened that it's a Gujarati માં કહેવત છે કુવાના મેંઢક. So we cannot see out of our boundaries, and our what you can say, comfort zone is so narrow that we can't think about any other branch also. So only work and work, and patient satisfaction is only our motto in initial life. So I think that should be you should have to keep in mind, but that should be in one corner of your mind. Another corner should always be developed in life, and I think it should be developed very earlier.
The last question to both of you. When it comes to doing something, the validation or recognition or anything with regards to feedback will be coming from the opposite side. That's for sure, right? Whether you want it or not. So there are only two ways to see that. One thing is people would praise you or people would criticize you. How much both the factors would affect whatever you're doing or with regards to the feedback that you receive?
I think criticism doesn't affect me at all. I never consider anyone's criticism for anything. For example, even for laparoscopy or endoscopy or even for singing for that matter. See, what you do, you have to give your best. Otherwise, I mean, few things may go wrong in it may go wrong with everyone. So that does not mean that you should criticize someone. And that wrong thing will go with everyone. So at least for me, I never take criticism at all seriously, because people have that habit to criticize. So they will go on speaking. So let them speak, whatever it is. I always have more concentration on what I do and how I can improve on that. See, I always have one principle in my life, that I always learn from my mistakes. See, that is very important. I never regret anything in my life. I never regret any decision or whatever I have done. It happens. You make mistakes in life, but then you have to learn from that mistake so that you can improve in future. People will keep on criticizing. Let them criticize. It doesn't matter.
Yeah, Bhavit sir.
Munja, criticism in professional work and non-professional work. So in non-professional work, if someone criticizes you, that doesn't make difference in your life, because it's not your main path. In professional work, someone is criticize you in initial days. I always feel some bad in my heart that someone has told me like this and that. But when you become matured and you spend certain years in your professional works, you always neglect this type of thinking. And nowadays, after certain year of maturity, I take criticism as a positive point. That how can I develop from this criticism?
Yes.
Right,
Well,
sir. Rightly said that we always have to improve from our mistakes.
Yeah.
And even though you don't do mistakes, the person are there who criticize you.
Yeah.
So always, what you can don't think so much on overthinking about your work and all these things, because
So I think,
overthinking also makes you dull.
yeah. So we need to develop that particular quality to filter out the
Yeah.
creative criticism from the something which is instigated by negative emotions in that. I think so. That's a fine line we need to learn. I think.
One quote from
So we believe that it may take some time, as you rightly
yes,
said.
definitely.
It may
And
take some time to develop that amount of maturity.
definitely. I
Yes.
also read Gita, and also I read a Buddha stories also, and I learned from Buddha stories that you are thinking over about the person who are not thinking about you at any time. So always you have to be clear that opposite person are not thinking so deeply about you. So go on doing what you love and what you do or did.
Yeah.
So that's
Thank-
I always apply in my life since last 2-3 years, not so retrospectively, but when I read this book, I always apply in my life.
Yeah, brilliant. So I think we can have concluding remarks from Devang sir and Bhavit sir, and then few lines by Ashish and conclusion by Kirtan. Yeah, Devang sir. Just to pass on something in few lines, to
Yeah,
pass on
I
something.
would always suggest that always follow your passion. Always follow your passion. And that will give you a lot of mental peace, mental relaxation, and a lot of things in life. So you have to follow your passion, whatever it is.
Brilliant. Yeah, Bhavit sir.
My conclusion about this meeting is that uh, be master whatever you want to do first, and for doctors particular, learn finance from bottom and from early years, so that you can retire earlier and you can follow your non-professional hobbies very early in your life.
Brilliant. Brilliant.
Thank
Ashish,
you.
To
yes,
gain
in few
that,
lines.
Thank you
yes,
so
yes,
much.
to gain that financial freedom right from your early years
Yes.
and to follow your passions, I would say,
Yeah,
is
Ashish.
the take-home message for the
Yeah,
viewers.
yeah. Ashish, in few lines, please.
Okay, yes, sir. Yes, sir. But thank you, Devang sir. Actually, we were very eager for you to speak on this, and Bhavik sir, because you are so much, you have achieved so much, and you have done so much work. And after that, we were all of us want to know that how you like your passions, singing. Sir is doing this and that. But at that point, that thing helps so much, and it is actually good to hear that. And so it is a lovely conversation, and many things to learn. And as sir so much, uh, but Devang sir said that by singing, that life is like mystery. So that you have to understand yourself. That is one thing that is there. But to
Kirtan.
live at ease, that is one thing. Thank you, sir.
Yeah, Kirtan.
Thank you,
Thank you,
sir. Thank you,
Munjal
both of you. And
team.
thank you,
Finally,
dear Munjal, for this wonderful, wonderful session and very innovative idea. And I believe that all the viewers must be benefited with this from this
yes,
Thank you.
non-academic
many
meeting.
congratulations on this idea. Really
Yes,
fantastic. Really loved it.
Yes.
After doing it, I really loved it.
Yeah.
Yeah, so
Actually, first time thinking about that how session will go on, because this type of work I have never done before. But you three are so friendly that after 5 minutes I go into this conversation from heart and brain.
wow.
we
So
all achieved that trance. We all achieved that trance, I
Yes,
think.
No,
Yes,
I,
correct,
I was
correct.
also thinking that people think that doctors are not speaking, and even we think that we are not speaking.
yeah.
Yeah. So I thank Kirtan and Ashish for standing by throughout the idea of this particular session. And Bhavit sir and Devang sir, you both have been excellent. I think we all look up to you people to achieve that particular mark in endoscopy. And now I think as much as I have started knowing both of you, I would say that in each of my passion, I would be having you as ingredient, as an inspiration. Because what happens is we all keep on running our own race. We become selfish at times, not to share our own experiences. Maybe at times, out of jealousy or competition or comparison, we would not share our experiences so that the other people would be, a little behind. And everybody, I think, every person on this earth would like to see, on the backside to feel good, that we are leading. But at the same time, there are people like you who would always believe in, taking people along with you. I think that's the difference that you all have from rest of the people, and that's why you people keep on inspiring throughout many decades, I would say. So thank you so much for this particular session, and
Thank
I'm
you, sir.
really honored that you both gave time to three of us. So we would like to have both of you in sessions to come as and when you people are comfortable, and maja aasha. So thank you so much.
Well, best of
Thank
luck
you,
for
sir.
this thing.
Thank you,
Thank
sir.
you.
Thank you.
Thank you
Bye,
sir.
sir.
Bye.
Thank you, sir.